Okay, so today we're talking about sexual disorders, specifically focusing on paraphilias. Paraphilias are when an individual becomes sexually excited using unusual imagery, acts, or objects. And so there are distinct patterns that deviate from what is considered normal sexual activity. And the distinction between paraphilias involves those that harm others and those that are victimless. So in assessing paraphilias with clients, first you need to determine if the paraphilia is normal or if it's pathological. And this depends on the degree of harm it causes and whether it's the person's preferred or sole way of obtaining sexual gratification. You need to ask your clients, what are the different ways that you become aroused to the point of orgasm? So often individuals have more than one paraphilia, and we see these more frequently in men than we do with women. So let's talk about specific examples of paraphilia. So first we have fetishism. And with fetishism there is a reliance on some kind of inanimate object or on a body part to the exclusion of a person as a whole for sexual gratification. Sometimes fetishes can be associated with the human body, such as fur, women's stockings, shoes, underwear, and the individual uses these things to basically masturbate with until the point of orgasm. With transvestism, there is sexual gratification obtained through dressing in clothes of the opposite sex. And after cross-dressing, this individual masturbates or has heterosexual intercourse. As a group, individuals in this category are no more prone to psychological disturbances than the general population. And for the most part, these individuals lead very quiet, conventional lives. Oftentimes, this transvestism is confused with other forms of cross-dressing. So, to distinguish it, cross-dressing for sexual pleasure is transvestism. Cross-dressing to assume a female role, such as drag queens who are typically homosexual or entertainers when they do this as part of a performance, is not transvestism. Other paraphilias include exhibitionism and voyeurism. So with exhibitionism, this is sexual gratification by displaying your genitals to involuntary observers. Most exhibitionists are not dangerous, and typically the exhibitionist is a young man who is sexually inhibited and unhappily married. And the gratification is derived from women who are shocked, who feel fearful and revulsion, and then these individuals masturbate to the reaction that they get from these women. So most exhibitionists are shy, submissive, immature men who experience feelings of social and sexual inferiority and who doubt their masculinity. And by exposing their genitals, it gives them some sense of masculine power. So then the best cure, if you are ever exposed to an exhibitionist, the best cure is to basically ignore it, to not respond to it at all, to not give them the satisfaction of that, oh my God, reaction. Voyeurism is another example of a paraphilia where sexual gratification is gained through clandestine observation of other people's sexual activity or sexual anatomy. So they're basically observing someone in some kind of sexual act or someone who is disrobing without this person's knowledge. And the risk involved in watching strangers is important to the gratification for voyeuristic individuals. So they usually are harmless, but they gain this kind of sexual satisfaction through thinking that it's possible that they could potentially get caught. Other paraphilias include sadism and masochism, or sadistic or masochistic behavior. So with sadism, sexual gratification is gained through inflicting pain or humiliation on other people. With masochism, sexual gratification is gained through inflicting pain or humiliation on oneself. okay? There are various degrees of sadistic or masochistic behavior. You can find lots of examples of this on the internet. Degrees of cruelty can range from just sticking a person with a pin or pinching someone, smacking someone, to complete physical mutilation. Oftentimes, individuals who are sadists and masochists, they seek some kind of complementary partner in a sadomasochistic relationship. Most sadists and masochists are heterosexual, well-educated, affluent, and undisturbed by their sexual activity. So they do not see this activity as problematic in any way. So that means, as a clinician, it's difficult to be able to draw the line between what is considered normal and abnormal behavior. And so in helping you to draw this distinction, in the DSM, it requires for this particular diagnosis that there has to be some evidence of distress or some kind of interpersonal difficulty. So it has to cause the individual some kind of personal distress to receive this particular diagnosis. If the people are not bothered by it, you would not give a diagnosis of sadism or masochistic behavior. Other paraphilias, Frotteurism. So Frotteurism, basically sexual gratification by rubbing or touching against a non-consenting person. So frotters operate in crowded places where they can escape easily, and they gain a sense of power over this unsuspecting victim. So if you've ever been in a large crowd of people and you feel someone rub up against you, it may not have been an accident. Perhaps this person really wanted to rub their genitals on you. So that's Frotteurism. And then we have pedophilia, where sexual gratification on the part of the adult is gained through sexual contact with a child who has not yet gone through puberty, so a prepubescent child. With pedophilia, they are the perpetrators are almost exclusively male. Heterosexual males commit pedophilia nearly twice as commonly as homosexual males. Most pedophiles are mild-mannered with profound feelings of masculine inadequacy. As teenagers, most pedophiles were frequently shy and awkward, and then in their relationships with mature women, they frequently suffer from inadequate sexual performance. They're basically unable to relate to adult women, and so they turn to children instead for their sexual gratification. Pedophilia is a very, very serious form of a paraphilia. It involves serious violations of the child's rights, and obviously children can suffer serious long-term psychological harm from being the victim of a pedophile. Additionally, as most pedophiles are male, most are also acquainted with the victim in some way. So most are family members or a family friend, so the victim usually knows this person. Incest can be another form of pedophilia. Incest is sexual relations between family members. Estimated rates of incest in family between 7 and 17%. And abuse by a father or a stepfather is the most typical relationship. Oftentimes it results from troubled marriages. So if the father and mother are having a difficult time communicating, father-daughter incest might occur, and then daughters might assume this caretaking role in the family, and then the wife is often isolated from other family members. But again, really highlighting the long-term psychological effects that can occur as a result of experiencing incest. Okay, so looking at theory, how do we treat paraphilias? Where do they come from? The behavioral perspective emphasizes conditioning and states that these deviant sexual behaviors result from a respondent or operant conditioning process where early sexual experiences are associated with unconventional stimuli. So, for example, a child may have learned to associate being spanked with sexual pleasure if, let's say, their babysitter who was spanking them was a very attractive woman. And so then the child starts to associate that kind of behavior with sexual activity, and that carries into adulthood. So behavioral perspective then looks at basically counter conditioning, techniques that are used to unlearn those patterns. With the cognitive perspective, you are looking at learning these deviant attitudes. So sex offenders tend to objectify their victims as sources of gratification rather than as human beings. So that's a very deviant attitude. To combat these deviant beliefs, cognitive therapists will use procedures to identify these deviation supporting beliefs, to challenge those beliefs, and then replace them with more appropriate beliefs. Many programs operating from this particular approach include training the victim in awareness, where they're confronted by the emotional damage that their behavior causes the victim. Lastly, looking at gender identity disorders, the last of our sexual disorders here. So with gender identity disorder, this is characterized by a sense that one's true gender is the opposite of one's biological gender. So you have this sense of gender dysphoria. Dysphoria, it's unhappiness with your gender, and then this desire to change to the other gender. So for this process of physically changing your sex organs to the other gender, you undergo what's called gender reassignment surgery. So this is one solution to change the identity to fit the physical body. Gender reassignment surgery, it's an involved process. It involves several steps. So first, you have to undergo a detailed evaluation by a mental health professional to make sure that you are psychologically fit to handle the potential changes here. You have at least 3 months of therapy following that, and then you also start with hormone treatments to initiate some physical changes. So let's say that you are a woman you're physically a woman, but you believe that your true gender is male. You would then take masculinizing hormones such as testosterone, and these would essentially make your body start to produce some of the male secondary sex characteristics, such as a deeper voice or facial hair. Then you would start dressing and living as a male, even though you still have female sexual organs. After you have done this for a time period, the last phase is the actual surgery. Okay, so the actual physical surgery for a woman to change your female sex organs to male sex organs, and vice versa if you are a man who believes that you really are a woman. So outcomes of this gender reassignment surgery are influenced by several factors. So first, the longer that the patient is kept in this real life test, so basically living as the gender that this individual truly believes that he or she is, the more realistic the expectations and the better the outcomes tend to be. Female to male reassignment yields generally higher levels of satisfaction with the overall procedure, but we need to also take into account the individual's prior psychological health as a predictor of success.